Inside this Mayo Clinic operating room, Dr. Timothy Curry and Dr. Adam Jacob monitor every heartbeat and breath, adjusting anesthesia and guiding patients through surgery one moment at a time.
We're always monitoring a patient's electrocardiogram, their oxygen saturation, their blood pressure, their temperature.
As anesthesiologists, they prepare for every scenario.
It's extremely rare to have a problem in anesthesia. It's an incredibly safe experience, and you have incredible clinicians that are watching over you every minute while you're under anesthesia.
Yet one condition can transform a routine procedure into a medical emergency. It's called malignant hyperthermia. Certain anesthesia drugs can trigger it. The vulnerability is written into a person's DNA.
The way we see it is that people develop really high temperatures. We start to see evidence that their body is becoming acidotic, which is a result of the uncontrolled metabolism.
Surgical teams train for malignant hyperthermia. A life-saving antidote is stocked in every location where anesthesia is administered. Without treatment, it can be fatal. An estimated 1 in 2,000 to 3,000 people carries this genetic risk, though actual reactions during surgery are far less common. Dr. Curry set out to determine whether those rare but dangerous emergencies could be prevented. He examined genetic sequencing data from more than 150,000 Mayo Clinic research participants.
We wanted to really understand how common is it for people who might have these genes in our population.
He identified 134 people with genetic variants linked to malignant hyperthermia susceptibility. Most were unaware. Each participant was notified and offered genetic counseling.
Once we identified those individuals, we then went back to our other research databases to try to understand how many of them might have had anesthesia, at least at Mayo Clinic.
The goal was to understand how often this genetic risk leads to complications during surgery. Among the carriers was someone Dr. Curry knows well.
One of those individuals happened to be someone who I trained in anesthesia with. He's one of my colleagues here at Mayo Clinic.
Yes.
That colleague is Dr. Jacob.
Terribly ironic.
The irony is hard to miss. An anesthesiologist trained to respond to this rare crisis was carrying the genetic risk himself.
I've had surgery a couple of times, and I fortunately have never experienced a reaction.
The reaction is only triggered by certain anesthesia medications. Those medications remain essential in emergencies, including trauma cases or when doctors must quickly secure a patient's airway. Because the condition is inherited, Dr. Jacob had his 2 teenage sons tested.
And it turns out they are both carriers of the same mutation that I have.
Their medical records were updated to guide future anesthesia care. They now wear medical ID bracelets.
It's a very easily managed condition, easily avoidable condition as long as you know, so knowledge is power.
Mayo Clinic researchers are also using this approach to uncover gene variants linked to hereditary cancers, heart disease, and other inherited conditions. In many cases, early detection leads to screening and targeted care. Genetic testing for malignant hyperthermia is now incorporated into Mayo Clinic's pre-surgery care. For Dr. Jacob and his family, a hidden risk can now be anticipated and prevented.
I have a greater appreciation for doing what I can every day for every patient, as though, you know what, maybe they're a carrier too.
For the Mayo Clinic News Network, I'm Susan Murphy.